Hey, and how you doing, folks? Yours truly, Randy Rand here for another edition of today's talk. Welcome. Today we spoke to Dr. Nekeshia Hammond, and we talked about oppositional defiant disorder. Now, if you've listened to the show for any amount of time, thank you. But if you've listened to the show for any amount of time, you know that I work with special needs children. I've done so for the past, about 30 years now. And one term that just uh, came to my knowledge just a few weeks ago is this oppositional defiant disorder. Um, I'd never heard of it before, believe it or not. I'd never heard of it before. And one trusted source that I really had the confidence in finding out about it was Dr. Nekeshia Hammond, who's a friend of the show now. And we talked about it. And we talked about the strain that it puts on the parents sometimes, as having a very difficult child can, take its toll on you. What are the causes of oppositional defiant disorder, which is also known as ODD? Um, what to look for in a child that suffers from ODD. And one question that I asked Dr. Hammond that I think really uh, needs to be paid attention to is that children, especially in the African American community, that suffer from oppositional defiant disorder, how those children, if not uh, diagnosed properly, will be seen as children that are, defiant, of course, non-compliant, uh, don't have any discipline, and they're going to have their run-ins with the law and often meet with very unfortunate ends or results. That was probably the most important question that I asked her for the whole interview. So you want to be sure and listen to the entire interview and find out more about oppositional defiant disorder, or otherwise known as ODD. It was a mind-blowing experience for me because, quite frankly, I always saw those kinds of children as, just difficult, or not taught any better, and so forth and so on. We even delved into that a little bit as to how, sometimes ineffective parenting might lead to oppositional defiant disorder. Um, it's a great interview. It's a great interview. We even talked about medication for it, and you'll be surprised uh, as to that there's no medication for ODD. However, children that um, suffer from ADHD uh, are often diagnosed with oppositional defiant disorder, and those children are already on meds, and they'll take meds. So the meds that are given for ODD are often the same meds that are um, given for ADHD. So you want to listen to the interview, and it explains it all out. This is yours truly, Randy Rand, for today's talk, and thank you for the time. And we're back. Yours truly, Randy Rand, here for another version of today's talk. And we are discussing, as a matter of fact, we're talking with Dr. Nekeshia Hammond of Hammond Psychology and Associates, who is now a friend of the show again. Thank you so very much, Dr. Hammond, and how are you?
I'm great. Thanks
Very,
for having me again.
very good. Thanks for giving us some of your very valuable time today, as we are going to be discussing oppositional defiant disorder, which is also known as ODD. Um, Dr. Hammond, if you could please explain what oppositional defiant disorder is.
Sure. So, oppositional defiant disorder is really a pattern of negative behavior that children have, and that comes in various forms. A lot of times it's temper tantrums, it's irritability, it's defiance, it could be verbal aggression, a lot of agitation. But it's really important to note that this is something that is constant with children that are diagnosed with oppositional defiant disorder, and also this is occurring for at least 6 months. So this is not your typical, child just acting out here and there. It's constant and it's very long term.
Now, what are some of the signs of ODD?
So some of the signs are parents oftentimes that I will see will, pretty much discuss that the child is very argumentative and they're not necessarily always having remorse for some of their actions. But in some cases, they may be vindictive. They're verbally aggressive. And also, it may come in different forms. For some kids, they are very rebellious and not wanting to listen to people in authority. So that could be teachers, that could be a principal, it could be their parent or some other authority figure that they are blatantly defiant towards. So there's a lot of signs of that.
Okay, now is ODD a matter of bad parenting or a chemical imbalance or something else we're not aware of?
So with ODD, what the research is really finding is it can be a combination of things. So absolutely, everything actually that you just mentioned. So with hostile parenting, with very harsh parenting, sometimes children that are in positions where they are just, kind of bounced around from different caregiver to caregiver. Sometimes children in foster care settings where they're going from placement to placement. But also there are chemical components as well, and there are children with ODD that they have found to have changes actually in their brain, as well as just environmental factors. So it could be neglectful parenting or just a lot of arguing that the children are witnessing at home in a very chaotic environment that they're in at home overall. So all of those things can really contribute to oppositional defiant disorder.
Okay, now are children from particular ethnic groups or financial backgrounds more predisposed to ODD than others? Please explain.
Yes, again, research is really finding that children with low-income backgrounds are more predisposed to oppositional defiant disorder. And my thinking is really because when you think about just meeting the basic needs of a child, and we're talking about shelter and food and those sorts of things, and when that at the basic level is disruptive and the family environment is very chaotic, it can be very stressful, obviously, in that household. So they're definitely finding a link with families from lower income, which sometimes or many times have higher stress levels in the home. They're finding a link with that in oppositional defiant disorder in children.
We are speaking with Dr. Nekeshia Hammond of Hammond Psychology and Associates, and we're discussing the topic oppositional defiant disorder, which is also known as ODD, and she's very kind to give us some of her very valuable time today. Dr. Hammond, children, especially children of color that
Hmm.
suffer from ODD are most likely to be placed in special education programs, aren't they?
Yes, they are, and I've been in a lot of different schools in a lot of different capacities, and I will honestly say that really and truly, depending on the school, uh, there's a massive difference in special education from one school, and then you go across town to another school. It's very different. So I
Agreed.
definitely think there are, very different. I definitely think there are pros and cons of that, depending on the program, but I will say that oftentimes what I've seen on a positive note is that children that are in special education, well, good special education programs, and get the accommodations that they need, it's a world of difference. So, for example, a child that is in a low income, coming from a low income background that has a chaotic home life and does display the oppositional defiant disorder, all of a sudden, when there are special education services and they get the extra time they need or they need a quiet classroom, all of a sudden you see the behavior start to change in a positive way. So I have mostly seen positive things come out of special education services, but again, as I mentioned, there are other programs that are, unfortunately damaging, if you will, to children as well.
So, to follow up with the question, this is a good thing for the children that are put into the special ed programs?
I have seen it more of a good thing. However, what I will say on that, to just put an asterisk on that, is that when children, it's about expectations too, because I do believe in special education. I've seen very positive results from it. However, especially for children of color, it depends on the teacher and it depends on their expectations of them in special education. So if whomever the teacher is going to expect something much lower than the child can actually do, that's not helpful to them at all. So that I will, like I said, kind of put an asterisk on that, that expectations are very important. But provided that the teacher is knowledgeable about cultural differences, and comes from that perspective and understands trauma and understands poverty and understands oppositional defiant disorder, yes, it can be very beneficial to be in special education services.
Now, this next question, I've been very excited about it, if I must say myself, because
Mhm.
I kind of see it happening, but then again, it's my own opinion. Children, especially children of color, please talk about the precarious position these children will find themselves in if the ODD isn't properly diagnosed and treated.
Yes, that is an excellent question because the fact of the matter is, and the way I view it as well, children, especially children of color, are labeled very quickly. And there's a huge difference of labeling a child as a criminal and as a threat versus a child that truly has a mental health issue. So early intervention is critical, and that is why I am trying my hardest through social media and whatever other means to express to people how important it is to get children evaluated early to see what is going on with them. Because, again, if a child has oppositional defiant disorder, there are avenues to take early on so that this child, which I have seen too, unfortunately, does not end up in juvenile detention when they really should be in therapy for oppositional defiant disorder. So it's critical. It is absolutely critical to get help early for this issue.
I know that many in our community believe that a good quote unquote ass whooping is the appropriate treatment for the behaviors displayed by a child that suffers from ODD. Is there a danger with this approach? Please explain.
Absolutely. There is a danger. I think it's a horrible approach. I know that my professional opinion is not, a popular opinion, but, and I know most people don't want to hear the research, but there are just numerous amounts of research on the effects of children that have been, abused, but also even non-abusive corporal punishment. And especially with a child that has oppositional defiant disorder, in many cases, spankings, beatings, whatever you want to call it, it's not going to be helpful for them. It may make the parent or caregiver feel better, but it's not really something that's going to be helpful when you have a mental health disorder that needs to be processed and worked on. So there's, again, many different avenues. I hope that many parents and caregivers, though, just don't know what those other avenues are, because my thought is most parents that, decide to spank, beatings, whatever you want to call it, use that approach are doing it to get compliance because they want the child to obey and follow the rules. But if you could get that same result but do something else, wouldn't you choose to do something else instead of beating a child? I would hope so. Again, my professional opinion is that's not the route to take with a child with oppositional defiant disorder.
We are speaking with Dr. Nekeshia Hammond of Hammond Psychology and Associates, and we're discussing oppositional defiant disorder, which is also called ODD. And Dr. Hammond is kind enough to give us some of her very valuable time today. Dr. Hammond, is it possible for a child to suffer as they grow into adulthood from ODD?
It is. It is possible to suffer. So ODD is a label or a diagnosis used primarily in childhood and adolescence. So we don't call it ODD once you're over 18, once you're in adulthood, but it does, for some cases, not the majority, but for some cases, it does morph into what we call antisocial personality disorder. It could morph into things like substance abuse or anxiety or depression or really, a greater sense of defiance, and that can come as an adult in the form of being defiant with an employer. There are, many people that get in trouble or go from job to job to job because they get in fights with the customers or the employees or the managers or supervisors or whomever it may be. That sort of just argumentative sometimes vindictive, very oppositional sense, or it could be with law enforcement or other types of authority as an adult. So it does, yes, it is possible to suffer from those same type of symptoms, but it's just not called ODD once you become an adult.
Since many children with ODD have also been diagnosed with ADHD, many take medication for this co-occurring disorder. Could you please speak to the significance of this?
Yes, so ODD that is true in the research. It has been found to many kids with ODD also have ADHD. So again, the medication would not necessarily be treating necessarily the ODD, but more of the ADHD symptoms. But I do think it's really important for people to remember that with any diagnosis, there are different levels of intensity or severity. So if the child also has ADHD, we also need to see what type of ADHD. Is this a mild form, moderate form, or a severe form where they literally cannot function without some sort of medication? Because I have seen numerous children that with therapy alone have dealt with ODD and ADHD without the medication,
Mm-hmm.
and at the same time, the severe cases, they will, need maybe a referral to a psychiatrist for medication. But not everyone needs medication, is what I'm saying. So we really need to think about how severe the symptoms are, how severe is it affecting their functioning in school and at home. I mean, are they to the point where they're getting in trouble with the law, or are they, being a little bit more argumentative at home? Are you at the point where you can't function and do your schoolwork, or, are you just having a little bit of trouble, you don't feel like doing your homework? So we have
Uh-huh.
to look at where they're at as far as intensity.
Now, for those that don't need the medication, what would
hmm
you suggest? Would just therapy work?
Yeah, and yeah, therapy, I have seen a lot of therapy only. And I think the great thing about children with oppositional defiant disorder, or this basically behavioral issue or behavioral diagnosis, is that it can be therapy, but it really can be, there's a lot of other type of interventions, and there's a lot of things that schools can do as well. They have found, research has found really good results with the Head Start program, for example, and just teaching children how to manage themselves, how to keep them emotionally healthy, how to problem solve earlier on, so that when these children are becoming so agitated with what's going on around them, they have the problem-solving skills to deal with it. So that's really what it boils down to. So therapy, and not everybody needs therapy, but therapy, if it's you tried everything at home, you tried in the community, you tried if you go to church or wherever it is, you tried all of that and it didn't work, then sure, the next step would be therapy. But there's a lot of different approaches, but really and truly, children need to learn how to manage themselves. And that's really boils down to ODD.
There are effective ways that parents can effectively deal with a child with ODD, but I want you to please speak about the difficulties parents may be facing dealing with their child that has ODD.
Yeah, so in my experience, some of the stories I've heard is, in some extreme cases, it's very difficult when, parents are having this basically a communication issue with their child, and it goes beyond them not wanting to do their chores or just not acting out. But this is a constant not listening, being argumentative. In some cases, again, children are doing this at school as well. So they're starting to get referrals. They're starting to get suspensions. I've had parents that are like, I'm about to lose my job because I'm going to the school so often to pick up my child, because the school is sending them home. So it really can have an impact, definitely emotionally, on a parent, but also financially. I mean, if you're at the point where you're losing your job because of this. So it really has a lot of impact with parents as well, and that's why I always stress for parents to obviously get your child help, but also for parents to remember to use the self-care that they need to do too, and take care of themselves, because it's not easy with ODD, and it takes a lot of patience. It takes a lot of patience, and a lot of support from others. So that's what I would definitely recommend as far as parents handling those difficulties.
because you had mentioned at the top where uh, to get an effective diagnosis of it, you would have
Hmm.
to be going through this for about 6 months. That is a living hell to have to deal with,
It's
you know.
yes.
And I really sympathize with the parents because one of the reasons why I asked if ODD was a matter of bad parenting or a chemical imbalance or what, because I wanted to get to the root of it, because I
Hmm.
I came across this some weeks ago. I'm like, what? I've never heard of that.
Hmm.
I've worked with children, special needs children, for almost 30 years now, and
Hmm.
had, believe it or not, never heard of this oppositional defiant disorder. So I wanted to come to you and talk to you about it, certainly, and it's
Yeah.
mind blowing. It's mind blowing.
Yeah, it is mind blowing, and I've actually seen it a lot, quite a bit. But it's really it's kind of neat, like you said, because there's so many contributing factors to it that, like you said, if you work on, and a lot of times too, it's not just the individual child that needs therapy, but it's the family that
Sure.
needs therapy. So that can be whoever's in the household. Everybody gets together
Hmm.
and work on the communication skills. So, or the parent thing, there might be parenting sessions that need to be had. So yeah, there's a lot of ways to work through this.
We have been speaking with Dr. Nekeshia Hammond of Hammond Psychology and Associates, and we've been discussing oppositional defiant disorder. And Dr. Hammond was very kind enough to give us some of her very valuable time today. Dr. Hammond, in closing, please feel free to plug your website or any other project that you are involved in.
Sure. So my website is hammondpsychology.com, and I'm also on Twitter at Dr. _Hammond. I'm on there pretty often. And on Instagram, I'm at Practical Parenting.
And I know that you had recently released a book. How's the book going?
Pretty good. Yes, it's The Practical Guide to Raising Emotionally Healthy Children. And that is available on Amazon or on barnesandnobles.com. And the book is going really great, and I've had the opportunity to talk to parents about how to make sure that their children stay emotionally healthy. So that's been really exciting. And yeah, that was just released, and pretty excited about that as well.
Okay, that's going to do it for our interview today, Dr. Hammond. Again, we thank you so very much for giving us some of your very valuable time, and we look forward to speaking with you down the road.
Sounds great. Thanks so much for having me.
Thank you.